Now we're gonna do ankle sprains. Next. And so for the ankle, I'm gonna have her seated for this one to show a little bit better technique. So go ahead and have a seat with your legs hanging off this side. And I'm going to have you take off your shoe for me. Now this can be done with them in their shoes if they're like cleats. We're concerned for a little bit of an ankle sprain or it feels tight, but it doesn't have to be done out of the cleats. So you can have the patient seated or you can have them supine. If they are seated, go ahead and just relax your leg down. And I'm just gonna let them rest on my leg. We're looking at that ligaments of it. So we're going to be gripping the plantar fascia and that plantar side of the foot at the calcaneus. And we're gonna give a little bit of external rotation and kind of pronating that plantar component. And then we're gonna be adding in a little bit of that flexion through the force. What we're gonna be doing then is adding just a little bit of traction and compression. And while you're maintaining this, we're gonna move them into a supinated dorsiflex position. So they start more in a plantar flexion and we compress and rotate them into a dorsiflex supinated. And you can repeat this technique multiple times until you feel good release of those ankles. Sometimes you may get a little bit of a pop in there. Next. All right, for metatarsalgia, next. This one is great for unwinding the feet. It is very similar to what we did for the wrist itself. I'm gonna show this from a posterior technique, but this can be done with the thumbs crossing over and coming out as well if you're facing the bottom of the foot. If you're on this side, just for teaching purposes, we're gonna do the opposite. We're going to use our hands and open up. So we start at that phalangeal metatarsal connection, and we're going to put compression in and rotation out. Compression in, rotation out. Compression in, rotation out, walking along those metatarsals, starting from that top and then going back down. This is done 3 to 8 times depending on how you feel the release. Go ahead next. Go ahead next. So for plantar fasciitis, usually that plantar fascia of the bottom of the foot is nice and tight, and what we want to get is that relaxed and released. So this is called a soft tissue plantar fascial release. You're going to be using the knuckle part of your hand at that MCP joints, and so you're basically going to be doing a ringing, rolling effect. And you're going to start and just go along that plantar fascia all the way from the metatarsal heads and down to the calcaneus. And it is just a rolling technique. And what I like to do is start lateral and go medial and continue to do that over and over again until